this is 21st century, this is 2025, and
Amazing.
we need personalized care.
And finally, I should mention there are some induction maintenance strategies that are ongoing involving T-DXd, like the Demeter trial is 6 cycles of T-DXd followed by a dual antibody maintenance with or without endocrine therapy for the steroid positive patients.
And maybe it's a patina regimen.
And maybe that's exactly where I was headed next. Do you think that's where we're going to land in the future? We're going to do T-DXd based induction folled by, at least in the hormone receptor positive subset, a patina like CDK maintenance? Is that doable, do you think?
No, I have been actually trying to advocate for that, and in my opinion, being on T-DXd for 5, 10, 20 years is hard, especially like you mentioned, the fatigue can be accumulative.
Yeah.
So I like the idea of maybe we use induction of T-DXd. I don't know if it's 6 cycles or even longer than that.
Yeah.
So hopefully we'll have more data using clinical biomarkers and MRD to kind of guide us with us, because each patient is different. Some may need shorter induction treatment, some may need longer. This is 21st century, this is 2025, and we need personalized care rather than here you go, everyone got 6 cycles of TJP, and I think that was not individualized care.
Right.
So hopefully we have more biomarkers and MRD to guide with our decision. And my bias would be, I do not want to say it's only 6 cycles, and I think it's a very tailored approach that with X number of T-DXd, when both the patients and the physician are comfortable to start maintenance therapy, perhaps followed by patina regimen or the two-kind approach. And I'm looking at hopefully the patients can be very stable on the first-line treatment for a number of years that we don't even need to consider the second-line therapy.
Very optimistic for that kind of vision for the future, and that may well be where we land one day. Dr. Yan, thank you so much for taking time out of your busy schedule here at San Antonio. For our listeners, we really hope that this discussion will be helpful to you in your clinical practice and has given you a little bit of a snapshot in terms of updates from recent meetings, and more to come. We expect more data in this space in the coming year or two, and it's going to be fast-paced, I expect, again, and practice changing, hopefully. And it's been a really exciting time to be a clinical investigator in the HER2-positive metastatic breast cancer space. And now we even see T-DXd moving into early breast cancer, both in the neoadjuvant and in the post-neoadjuvant setting for patients with non-pathologic complete responses after neoadjuvant. So more to come. Thank you very much for listening, and we look forward to giving you future updates.